Let's turn our attention now to the health sector. The Federal Medical Center, Umuahia, says that it has placed surveillance no fewer than 30 persons who allegedly had contact with a female doctor who reportedly died of Lassa fever. The medical director of the hospital, Dr. Wabale Chukwu, made this known at a news conference at Umuahia, that's the state capital, to formally announce the death of medical officer Dr. Chizoram Nduku. Medical Doctor Clement Ogeleyinbo joins us now on the News Hour to talk more about this. Thank you very much indeed for coming, Doctor.
Thank you.
All right, the National Lassa Fever Operations Center, if you remember very correctly, was activated in Abuja sometime in January to respond to outbreaks of Lassa fever. Well, will you say that you are satisfied with its activities so far?
Well, the activities of the Lassa fever monitoring teams have been quite commendable. But the problem is the individuals, because it's very, I think getting information down to the grassroots is becoming a bit difficult. We advise that people should stop eating the bush rats, adopt a very clean environment, keep your food covered and cook your food thoroughly. But that seems not to be the case, because when you look at the statistics given out on the 25th of March and the one just released, the incidence is growing. It's now 142, and with 400 confirmed cases in 20 states compared to where we were before. So what the federal government should do, the Ministry of Health, is actually to increase the number of people on the field to give more information about preventions. And if you have any symptoms, just go to medical center. Seek help rather than adopting a self-care method.
As if that's not bad enough, there's also a rising trend now of medical personnel. The available hands on ground are even at risk. We've seen how this doctor has fallen now in the hands of duty, and it comes at a time when the authorities in Abia State are saying they have the drug in abundance. So then one wonders, and let's not even forget that there is some confusion as to where she could have contracted this disease. How do you relate with all this?
Well, the problem when you have outbreak of any communicable disease, from the danger to the medical personnel is very great. In this case, there could be so many ways in which they have contracted this disease, either through the fluid of the infected people, through their clothing, through beddings, and all the rest of them. One thing I have noticed is sometimes we in the medical professions take it for granted, our personal hygiene. The issue of you wash your hand thoroughly, the door handles, everything in the surrounding, the hospitals and all the rest of them. The issue of sharing pens and all the rest of them. Those things are important. It's difficult when you are in the medical professions. You always put your life at risk in saving others. So we just have to go back to the drawing board. You wash your hand every 10 minutes. It
cuts across. It also affects the medical personnel.
Yes, yes. But the only way to do this is by washing our hands thoroughly. Make sure we keep every infected clothes away from contaminating other people. And
all right.
Be very careful.
All right, now beyond some of these reactionary approaches that we have always taken, have you seen deliberate attempt by health authorities, government agencies to engage people as to what they need to do in order to prevent what's on ground at the moment?
No, I mean, that can happen, because if anybody in the medical professions, it's your job. You don't have to be forced or deliberately, any institution deliberately putting anyone in danger. No, that's what we train to do. No. The question I'm asking is whether you have seen any deliberate attempt on government to inform people, to sensitize people, to enlighten people as to what they need to do to prevent the disease. That's a very difficult question, but yes, there is always room for improvement. Enlightenment.
But shouldn't there be?
There should be, yes. That's the duty of any authority. There should be more information, enlightenment, radio, television, newspaper, road shows, because it's becoming a very difficult situation at the moment. Yes, the government, the authorities should have done better. They have tried, but there is more room for improvement.
I'm even curious now about the ratting campaign now that I've seen, you know, spreading across the nation. I'm afraid we don't have time now, but, you know, how easy will it be now to curb the spread of the growing rat population? I don't know if you can make that as brief as possible.
Well, basically, it's adopting a very hygienic conditions, keep your surrounding clean, cover any cracks and windows, and keep your food covered, and then just kill as many rats as possible. People should stop eating rats.
All right. Dr. Clement Ogeleyinbo, we want to thank you very much for your analysis of the situation on ground, and hope that indeed all this will help. Thanks, Doctor.
Thank you very much.